Basically, as a practice nurse in our surgery, I've got appointments that run out throughout the entire day. So I start about 8:30 in the morning, and depending on what day it is, if I'm doing general practice nurse stuff, I've got appointments, basically either 10-minute or 20-minute appointments throughout that day. Totally varied. I can have anything from a blood test, from a smear test, from an asthma review or a COPD review, so it is varied. I started off in the hospital, so as soon as I qualified I went onto an orthopaedic ward in the hospital, which I really enjoyed, but it involved shifts, night shifts, back shifts, and I was kind of at the age where I was starting a family, so I decided that shifts probably wasn't for me, and then I moved into community nursing. So I did community nursing for a good long while as well, and then I decided for a change, and then practice nursing has just been my niche. I absolutely love it. It's also quite nice that we don't work weekends or bank holidays, let's be honest. So for family life, it fits in well with the family balance. I love the fact that I see sort of babies literally from 8 weeks old, so I do baby immunisations, and then obviously elderly patients in the 90s. So it's a complete variation of all ages.
So there's a range of ways that you can train to be a registered nurse or embark on your career in nursing. One of the ways that you can start your training is in the nurse associate role. Nurse and associates training, you can go through university, so direct entry route, or you can do it via apprenticeship route. It usually takes around 2 years to train, and it's a role that kind of bridges the healthcare support worker and registered nurse role. It's a protected title, is nurse and associate. Once you complete your training, you are eligible to register with the Nursing Midwifery Council, so the NMC. The nurse and associate role works across a lot of health, primary care and social care settings. Roles and responsibilities will differ depending on which setting you work in. So with the direct entry, you would be at university. With the apprenticeship route, you get the opportunity to earn and learn at the same time. The nursing associate and the degree route both have a mixture of academic and work-based placements. So when you go out on placement and you work with the wider team, as a learner in placement, you'll get support from the staff and from additional practice education teams if they're available.